Thank you for staying with us right here on Good Morning Namibia. Now, we are in the festive season, and the festive season is upon us. Now, emergency medical services often experience an increase in call-outs during this time. Joining us in studio is Fabian Martens, an advanced life support paramedic, to speak to us about festive season health risks, emergency preparedness, and the vital work that paramedics continue to do during this festive season. Good morning, sir, and welcome to the show.
Good morning. Thank you.
Thank you for taking the time to talk to us about this very important matter, as we know that emergencies tend to spike during this time of the year.
It is very important actually to be here, to make awareness also what people can do and how we can interact together.
Now, let's start with your role as an advanced life support paramedic. What does your role typically involve during the festive season when it comes to movement, when movement, travel and celebrations are at their peak during this time?
The roles of a paramedic are actually similar like through the whole year. It is working with the team on the ambulances. If it's a car accident with a mass casualty where more than one patient are injured, it is also coordinating together with the MVA fund where these patients go and also to make sure the best treatment. At some serious incidents, it is also vital for us that we talk with the team, with the ambulance team, with the responders after that, to have a kind of debriefing that the trauma, what the people have in their life, and the paramedics also see day to day, is not stuck and the people do not take it home to their families.
Now, in the Namibian context, which kind of emergencies do we normally see spiking during this time of the year, whether it be on roads, at home, or at holiday destinations?
It is actually three what we see on spike. The one are unfortunately the car accidents, which are due to the higher traffic, where it's very vital that everybody sticks really to the traffic regulations which we have. Then the incidents will decrease. At the coast, we see an increase of drownings, which unfortunately this year we had already some increased drownings, and we all read about also our colleague who drowned while rescuing other children.
Quite unfortunate.
And last but not least, also something what can be preventable is unfortunately alcohol-induced assaults, that when the people get too drunk, they start unfortunately assaulting each other.
Yeah, but on that point, I'd like for us to dig a little bit deeper there, as alcohol use often tends to increase during this time of the year. From an emergency response point of view, you said that there's normally an assaults as a result of alcohol-induced arguments. How does this contribute to the types of cases that you respond to beyond the physical violence?
It contributes actually quite a lot. The alcohol in general, doesn't matter if it's medical cases or trauma cases, alcohol plays a big role in many of the cases we are attending. And it is sad actually to see that people don't know their own border of, okay, how much alcohol can I drink? We know everybody wants to have fun. The year was a very stressful, busy year, what we had 2025 for many people. And they want to unwind, but we must unwind with limits.
Coming to the roads, many Namibians will be on the road, traveling to their respective hometowns, visiting various holiday destinations. What practical safety steps can family take on the road to prevent avoidable accidents and medical emergencies when traveling for the festive season?
The gentleman just before me who spoke about fitness is number one, also staying fit while driving. It's very vital, so that we make also enough breaks in between. I know we want to quickly go to the coast, we quickly want to go to the north to reach our destination, but it comes to a cost to the body. The body gets quickly exhausted, And it's important that we drink enough fluid. That means to have a water bottle or a juice bottle next to us while we are traveling, and to make breaks. When we make a break, just walk around the car as a driver to stay fit, to go with the circulation. So like he said, being active, circulate the blood flow.
Also keeps the brain awake.
Yes. And if you feel tired, make a short stop and make a nap. I did it the same last weekend. I came from a short visit out of town, and I was very tired because I got up at 5 o'clock in the morning, and we were driving back in the late afternoon, and I felt tired. And I stopped at one of our stopping places at the street. I napped for 10 minutes. I was fit after that. So yes, it is 10 minutes maybe from my time, but it really helps reaching it. And the last important thing is that everybody in the car fastens the seatbelts. We have it so often, yes, driver, side driver, they fasten the seatbelt. The back drivers at the back, they don't fasten the seatbelts. And often it's them, because they don't fasten the seatbelt, it's who are more injured or can have even a deadly cause.
More susceptible.
So please, all in the car, always wear a seatbelt.
Because it's better to arrive late and alive than not at all.
That's true. And often when you drive according to the speed limit, when you're driving your 120 on the main road, you see always the people overtaking. And I have it so often, the same car on the road, on a road of 400 kilometers, 800 kilometers, overtakes me 3, 4, 5 times. The same car. Then you see, okay, they're driving fast, but they must also refill more often. And so it's costing you even more. So if you drive your relaxed 120, make some short breaks in between, you arrive much safer and cost effective.
You mentioned earlier that one of the other increased incidents that we do see during the festive seasons is also drowning, including the very unfortunate incident that took place earlier this year that claimed the life of one of your colleagues. For parents and guardians, what should they be looking out for in regards to children's safety, especially around bodies of water?
If you see that they call it RIP tide, if you don't know how it looks like, you can go also, for example, on the West Coast Safety Initiative Facebook page. They're showing it on a regular basis, especially now to the festive season, where you see, okay, that is already the tide where my bodies can get drawn out into the ocean, and go only into the ocean where you see there are lifeguards close by. There are lifeguards along the coast of Swakopmund and anywhere else. Also important is know the local emergency service numbers. That is very important, because if something happens, seconds counts.
And before I let you go, this season can be physically exhausting for first-line workers such as yourself. What makes this period emotionally and mentally demanding for paramedics, and how do your team cope with this?
Yeah, physically we must be always physically fit. It doesn't matter if it's during the festive season or not. You can always have your patient who weighs the 150 kilos and so on. So you must be always physically fit and do your exercises. Emotionally, yes, this season is a bit emotional, because as an emergency responder, you're coming into the home of families you have never met before. And it is always normally a tragic moment when you're coming there. Sometimes people unfortunately calling the emergency service a bit late, so that we have a better outcome of the patients. So it is there a bit emotional, especially when children are involved. How we cope is actually, as a team, we talk with another. And even if it's a very traumatic team, we have from our side as background the Trauma Healing Network, who then can come in and also debrief with our team, with the medics, if it's a very severe traumatic team.
You raised a very interesting point there. You said that sometimes it happens that people contact the emergency services quite late, which can result in fatalities. What are clear signs that somebody should be calling for help and must seek emergency medical assistance?
Yeah, especially a trauma calls that people immediately call normally because they see, oh, there's some blood, there's something. What should not be there. The more important things is at medical emergencies, that where you cannot clear 100%, is it now, for example, a stroke? Is it a heart attack or anything like this? That means if you see your patient or the person who is with you, and you know them normally best, is completely abnormal. That means if they are having slurred speech, if their face droops, if they have pain in the chest or in the arm, or any other pain which they cannot locate, where is it out of a sudden coming from? So everything sudden, immediately call the emergency service. Don't wait any 5 minutes or something like this. Call the emergency service immediately, especially in a case of a heart attack or of a stroke. Call the emergency services immediately. And if you don't know the emergency number, you can always call in this country. You can call 112 or 911. But also you can, it's a combined number, 9112. These are emergency numbers you can call. And they can give you assistance nationwide. What is the number of your nearest emergency service?
Thank you so much, Mr. Martens, for taking the time to talk to us and outline some of the festive season risks, as well as the crucial role that emergency first responders play during the season.
It is my pleasure. Thank you.